Mrs. Jones, a client who hasn't been to the office in 2 years. Hygienist. Good morning, Mrs. Jones. I haven't seen you in a while. How have you been? Mrs. Jones. Not well. My husband was diagnosed with pancreatic cancer, and I have been busy taking care of him. It's been 2 years since I've been here. I need cleaning, but I also have some pain in my back teeth and my jaw hurts. I'm sorry to hear about your husband's diagnosis. That must have been incredibly challenging for you. First, let us make sure we'll address the pain and discomfort you're experiencing. We'll start with a thorough examination of your teeth and jaws to identify any issues. It is important that we understand what might be causing the pain in your back teeth and jaws. After that, we'll proceed with cleaning and remove any plaque and tartar that might have built up over the past 2 years. Given that it's been a while since your last visit, is it important to get your oral health back on track? If you have any other concerns, if there's anything specific that's been bothering you, please let me know. We're here to help you through this, and we'll work together to get you feeling better. This response shows compassion, addresses her immediate concerns, and reassures her that her needs will be met comprehensively. Mr. Vasquez, a client who is taking multiple medications and complains of xerostomia. Hygienist. Mr. Vasquez, I just looked at your x-rays and I see a few suspicious areas. Are you having any pain or sensitivity? Mr. Vasquez. Well, now that you mentioned, I forgot to tell you, I notice my teeth have been sensitive lately, but only sometimes. Thank you for letting me know about the sensitivity, Mr. Vasquez. It is important that we address this, especially since you've noticed it recently. Given that you're taking multiple medications and have xerostomia, sensitivity can be a common issue, as reduced salivary flow can lead to dryness and increased sensitivity. Here's what we'll do. I'll perform a thorough examination of your teeth to pinpoint the cause of sensitivity. This will help us understand if it's related to your medication or any recent changes or possibly issues indicated on the x-rays. We'll carefully review the suspicious areas on the x-rays to determine if there are any underlying issues that need attention. This could include cavities, enamel erosion, or other conditions. Based on our findings, we'll discuss appropriate treatments. This might include fluoride treatment to help with sensitivity, changes to your oral care routine, or specific products designed to reduce sensitivity. We'll also talk about managing dry mouth, as it can contribute to sensitivity. There are various products and strategies we can use to help alleviate dry mouth, which might also help with sensitivity. Our goal is to address these concerns comprehensively and ensure you're comfortable with your oral health. If you have any more questions or specific concerns, please let me know so we can make sure everything is taken care of. Mrs. Reed, who just brought her 6-year-old daughter, Chloe, for checkup. Hygienist. Hi, Mrs. Reed. The dentist just completed exam on Chloe. She is recommending sealants on some of her back teeth and fluoride treatment. Mrs. Reed. Oh, I don't know. I don't like to use fluoride because it's linked to neurological problems. And aren't sealants made of plastic? I don't like that either. Mrs. Reed, I understand your concern about fluoride and sealants. Let me provide you with some information that might help you clarify these recommendations. So for fluoride treatment, fluoride has been extensively studied and is recommended by many major health organizations, including American Dental Association and Centers for Disease Control Prevention. It's been proven to strengthen the enamel and help prevent cavities, which especially is important for children. The amount of fluoride used in treatment is very controlled and safe. The benefits of preventing tooth decay far outweigh the minimal risk. There is no credible evidence that link fluoride used in dental treatments to neurological problems. As for sealants are used to protect the chewing surface of the back teeth from cavities. They act as barrier to help food and bacteria out of the grooves of the teeth, where cavities often form. The material for sealants are tested for safety and they're designed to be durable and effective. They're a preventive measure that has shown to significantly reduce the risk of cavities in children. If you're still unsure, I'm happy to provide more detailed information or discuss alternative options with you. Our goal is to ensure Chloe's teeth stays healthy and provide you with all the information that you need to make the best decisions for her care. Mr. Chen, who refuses radiographs often, has been 7 years since FMX and 3 years since the last bite wing x-ray. His caries risk is low, but he has periodontitis. Hygienist. Okay, Mr. Chen, thank you for the updates on your health history. It looks like you are due for your cleaning, a full set of x-rays and exam today. Can we get started? Mr. Chen. I really don't want x-ray today. I understand your hesitation about x-ray, Mr. Chen. I appreciate your honesty. Let me explain why they're important for your care today. Even though your caries risk is low, you have periodontitis, which is a condition that affects the tissues and the supporting teeth. X-rays are crucial for a few reasons. X-rays allow us to see the bone loss around your teeth and check for any changes or loss of bone that may be associated with periodontitis. This helps us understand the extent of the disease and tailor your treatment effectively. And also X-rays detect hidden issues. They help us identify the potential issues that are not visible during clinical exam, such as areas of bone loss or problem between the teeth. This is important for comprehensive care and preventing further complications. X-ray will also help us monitor the progress. Since it's been a while since your last full set of x-rays, having updated images help us track the progression of your periodontitis and evaluate the effectiveness of your current treatment. We use the lowest possible radiation dose to ensure your safety, and the information we gain is essential for providing you with the best care. If you have any specific concerns or would like to discuss this further, I am here to answer your questions and address any worries you might have. Your health and comfort are our top priorities. Mr. Limon, who has exhibited dental anxieties in the past. Hygienist. Hi, Mr. Limon. Thank you for coming in today. Let's review your medical history. Last time you were taking 10 milligrams of lisinopril daily for your high blood pressure, 20 milligrams of Lipitor daily for your cholesterol, and 20 milligrams Lexapro daily for depression. Has anything changed in your medication? Mr. Limon. Yes, I started taking new medication for anxiety, but I cannot remember the name. Thank you for letting me know, Mr. Limon. It's important for us to have the most current information about all your medications, especially since they can affect your oral health and treatment. If you're unsure of your medication name, you might check with your pharmacist or your health healthcare provider for the exact name. In the meantime, we can proceed with your appointment and we'll take extra care to make sure you're comfortable throughout the procedure. Also, if there's any specific concerns or ways we can help manage your anxiety during today's visit, please let me know. We are here to make sure that you feel relaxed and at ease as possible.